On the breakfast show, and as we mentioned earlier in the beginning of this edition of the program, we are going to give some sort of advice or tips to the diet, regarding the diet of the people suffering from heart conditions, and it has to come from a specialist, and the specialist today is Professor Dr. Amr Matar. He is clinical nutrition consultant, and he is also the head of the Egyptian Society of Clinical Nutrition. Good morning to you, Doctor.
Good morning, Dr. Matar. First of all, we need to know the different reasons behind the heart problems. I mean, are there causes for heart problems, or it's inherited?
Sure. Let's give a brief about what can hit my heart. We have three main diseases that can hit the heart. The first of them that's concerned the arteries going to the heart. That's the feeding of the feeding vessels of the heart, and this is what we know as a coronary heart disease, or a heart attack, what the people know as heart attack. The second is a disease that attacks the muscle of the heart. We know all what the heart is a muscle. It starts beating when at the first of being born, and it stops when we die. That's the muscle continuously working for 24 hours non-stop, seven days a week. This huge, very energetic, very powerful muscle, sometimes it gets some sort of a disease, and we're going to tell you exactly what happens. The third is the nerves of the heart. There are nerves in the heart, yes, and they are controlling our normal rhythm of beating of the heart. And when this is disturbed, we get what we call arrhythmia, irregularities of the heart. And these are the main three categories of the heart disease. The most common is the coronary, what we call a heart attack. The heart is supplied by a group of vessels that surrounds the heart at the crown, and that's why they call it a coronary. So to make sure that every part of the heart is very well nourished with blood. When something goes wrong with these arteries or the supply of the blood to the heart, we get what we know as the heart attack, or pain in the chest, or it's a heart attack.
And is there a certain age for such a heart attack, sir, or it could hit any age?
Well, actually, for heart attack, it's common above 40. But nowadays we see it in the 30s and late 20s, and yes. 20s. We have an enormous amount of stress around us, all over us, and especially in these days in Egypt, we have a lot of stress, and stress is one major cause of this heart attack. What happens actually is our coronary vessels with stress or with other diseases like atherosclerosis and with obesity, our vessels get constricted, stenosed, narrowed. When the vessel gets narrowed, the blood going to the heart is lowered, it's minimized, and this is what gives us the pain. It's a warning sign that something dangerous, something very serious going on. Beware that you have to do something about it. This gives us what we call as a heart attack. It's in the form of pain in the chest. You feel that a very heavy thing is going there. It's a stopping pain. It's sometimes related to the left shoulder and the left arm. It's characterized by being stopping. It's very severe, and you feel near that state. It's something serious going on, and the near-death feeling is there. We have to do at this time to dilate the vessel to make sure that the blood is going in the right amount to the right part of the heart. If this narrowing goes for a long time, we get what we know as heart infarction, because a part of the muscle is not getting the right amount of food, so it dies. And when it dies, we lose part of the muscle as a power, as contracting muscle. So one part of the heart is now dead. It's there already, but it's not functioning. So we get disease of the muscle, and this we call heart infarction. Another group of diseases is a group of the nerves of the heart. You know, we have a net of nerves giving every part of the heart its electrical signal. So we make sure that the heart, which is formed of 4 main chambers, contract all together in 1 second, in one time, simultaneously.
But sometimes we feel that there is a heartbeat that is skipping or...
This is what happens when we have this problem with the network, with these nerves. normally we don't feel our heartbeats.
Yes.
So everyone wants, now we have a heartbeat normally from 60 to 90 per minute, beat per minute. If we feel it every time, we're going to die soon.
I know.
It's not normal to feel that.
I have a friend, she was complaining of that, and she tried to see her blood pressure and the heartbeat, and it was normal. But there was that heartbeat that.
Yes, we call it it's an extra systole. It's a premature heartbeat. It's a heartbeat which does not belong to the normal rhythm.
I diagnose it as tension.
Tension is one of the causes. Tension is one of the causes.
Yes.
But many other causes there. When you get an abnormal heart rhythm, you have to know what's the cause and you have to treat it, because if this is going on and it's going seriously more and more, and it increases in the number and in the frequency, this can lead to a serious condition, and sometimes it leads to stopping of the heart and death. So we have to take it seriously when we don't have this normal rhythm of the heart.
Right. How much of a relevance between the heart problems and the chronic disease like diabetes, like cholesterol, like thyroidism, like those?
These diseases you have mentioned have a direct relation to our heart, because what controls our heart for the rhythm and for the contraction is what you have said, the condition of the body as a whole. Even when you get stressed, you get an abnormal heartbeat. The diabetes called what we call sometimes a silent myocardial infarction. It predisposes to atherosclerosis, which means our vessels are not as elastic as would before, and the vessels are narrowed. So the normal amount of blood going to the heart are less, and we can be subject to a heart attack. The thyroid hormone is a general metabolic stimulant that stimulates all our body, including the heart. When you have a high thyroid hormone level, you get tachycardia, you get what we know as a very rapid heartbeat, and you get a rapid metabolism, you get sweating, you get all your systems are working at a higher rate. And on the contrary, when you have your thyroid function is below normal, you get a bradycardia, you get slow heartbeats, you get slow rhythm, you go to sleep early, you sleep for a long time, your functions are lower because the general metabolic stimulant effect is less.
Okay. Dr. Amr, could you tell us, are there any types of food that are good for the heart and other types of food that are bad for the heart?
Sure. And these are of vital importance. We have to know it by heart. All of us, you have to know this. Some food can cause heart disease, and on the contrary, food can prevent and in the same time can cure heart disease.
Very well.
Well, recently, an American study not recently, 7 to 8 years ago, and this study, I don't know why it's not that popular. Maybe the surgeon wants to do their job at a higher rate. It said that if you are on a good diet, a good planned diet with specification I'm going to tell you later on, people with a coronary heart disease, if they lose 5% of the body weight and they are on that diet for 3 months, the frequency of the heart attack goes down by 30%. The blood cholesterol is lowered by 10% only in 3 months. And the incidence of myocardial infarction and further serious complications is much less.
So could you tell us this type of diet
yes.
briefly?
There is a whole plan. One of them is a diet. It's a 4-category plan. The first is diet, which is very important. I'm going to do later on the details of diet. I'll tell you the 4 first, and then we go for the diet in details. Number 2 is the exercise. Special type of exercise. Number 3 is relaxation. Number 4 is meditation. You have to do all the 4 together to get the result. Well, diet is the most important of them, and diet with the following characteristics. First of all, we have to stop eating meat and animal proteins for a while. We have to clear our system from this. Well, it's not harmful, but we have to stop for a while, for 3 months, the animal protein. We go for cereals, and we go for fruits and vegetables for these 3 months time. We stop saturated fats, all kind of saturated fats, and we know, we have said before, what about saturated fats? We have to do, we have to eat a lot, we have to take a lot of fluids. We have to get good sleep.
That's the hardest
part.
That's
the hardest part, yeah.
I mean, we can stop eating meat and protein, but getting good quality sleep, that's the hardest part.
The second part is exercise. We have to do exercise because what exercise actually does, it opens what we call as a collateral blood vessels. We have mainstream blood vessels, we have collaterals. If my stream is blocked and my collaterals are, if we have a traffic jam and this street is blocked and you have another side way or shortcut or another way to go to your destiny, that's fine. You can go there at the end. So this, what happens with good exercise, regular exercise, the best is to start walking. And walking is very beneficial, but regularly, 30 minutes a day, at least 5 days a week.
Right. We find sometimes that people with heart problems or who have experienced some palpitation or something before, when they undergo surgery and they undergo anesthesia, they have palpitation. Could that be a signal to heart attack?
You mean before surgery or
no? After the recovery.
In the recovery, sometimes it can be, but usually during the recovery period, it's not abnormal to have this kind of arrhythmia because many things happen. The recovery period is not a balanced period. Sometimes we see this kind of arrhythmia, but
what's the reason?
The reason is that the systems, during anesthesia and surgery, it's a stress thing. You get hormones of stress, and hormones of stress, the first thing to do is to increase the heart rate, and that's why we get arrhythmia.
Okay, sir, you said that there are certain types of food that could be good for the heart.
Yeah.
You mentioned, of course, drinking more fluids and so on and so forth. But what about the certain types of food that could be actually beneficial to the heart? Are we talking simply vegetables and fruits, or cereals, grains, what?
Well, if you want to know what exactly can open your vessels and what can...
Yes, that is the question.
Well, let's say that every green is good. Every green is good. The green things are the best. And we have the artichoke, which kharshuf. Yes, it's beneficial to the heart muscle. We have all the green, dark green leaves. It have what they call nitrates, and these are the normal things we put in the drug for the coronary people. They put under the tongue. It's nitrates. So nitrates also are present in the white meat. That's why we give the people of the heart a white meat, not a red meat, to increase their nitrates. And we have to stop the saturated fats altogether. Okay. And this goes for all the butter and all the margarines and all types of oils in general. Okay. We have to increase the polyunsaturated fatty acids. The polyunsaturated fatty acids, it's what we know as the omega-3. The omega-3 is very beneficial to the heart. It increases the amount of flow to the heart. It stops the aggregation of the platelets that can cause a clot that blocks the heart. It's very nourishing to the brain. They call it the brain food, the omega-3.
So we should not wait until the problem happens.
No,
we should start as early as possible. We should try to follow a healthy way of living. That includes the diet, that includes drinking a lot of fluids, that includes walking for 30 minutes, at least 5 days a week, and having good sleep.
We have 7 commandments after the age of 40, and if you can do it before 40, it would be nice. The first is, if you are a smoker, you have to stop smoking. The second is you have to lose your weight if you are overweight by 5 to 10%. Third is to have eat 1 apple a day, 1 baby aspirin.
It keeps the doctor away.
Yes, 1 baby aspirin. Let me finish the 7, please.
Okay, but please make it brief because
we have finished. You have to take baby aspirin and vitamin E, and baby aspirin, vitamin E, 1 apple, and 2 garlics or 2 tonics. You know the garlic? It's very beneficial to the heart.
I wrote that down.
Yeah, okay.
I hope our dear viewers did as well. Thank you for giving us what I call the recipe of life with Dr. Amr Matar, a clinical nutrition consultant and head of the Egyptian Society of Clinical Nutrition. Thank you very much for being with us this morning. Thank you, Dina, for being with us this morning. I'm a guest today, Saturday. Thank you all dear viewers for